Alcohol-related liver diseases are the most common reasons for liver transplantation in the United States and other parts of the world. And there's been a lot of changes in how we approach this disease and how we can help these patients. These patients were frequently disserved. They were frequently too ill or did not make it to transplant. And so the field moved towards offering transplant to patients with limited sobriety. These medications for reducing cravings for alcohol have been around for a long time, and they're quite safe and used in the addiction space quite widely. So we just wanted to see if we can just start them off right after the bat, after transplant, and see if this would reduce the rate of relapse as a preventative intervention. The response rate was greater than we expected. In the 21 patients in our initial analysis that was just published, none of those patients relapsed to heavy alcohol use at 1 year. Overall, we considered this a kind of an unexpected success. The treatment of these complex conditions like alcohol addiction is not something that can be addressed with the medication alone. Protocol involves frequent appointments with our addiction psychologists and frequent testing to detect relapses early so that we can intervene early. There are so many aspects to the post-transplant journey. One of it is just the improvement in the quality of life of that individual because they have been suffering for so long from liver disease. The other aspects, of course, are the treatment of their underlying disorder, which is addiction to alcohol. And then the other aspect of it is honoring a donor family that had so graciously and generously volunteered to donate the organ to save that individual's life. And we are responsible for those organs to be well taken care of. And therefore, we see this as kind of an ethical obligation for us to do everything in our power to improve the outcomes for the patient and honor the life of that donor. It's important that we address alcohol use disorder as a disorder and try to address it objectively without stigmatizing those patients. The hope that I have is that this manuscript will stimulate discussion in the field and wider adoption of interventions like this. It doesn't have to be exactly this, but this is a simple intervention that is safe and cost-effective in potentially reducing bad outcomes